The views, thoughts, and opinions expressed in this podcast are solely those of the individual speakers and do not necessarily reflect the views or opinions of any affiliated organizations, employers, or sponsors. This podcast is for informational and entertainment purposes only and should not be considered professional advice.
Hi Malvi, how are you doing?
I'm good. How are you?
Good, good. Thanks for coming on. Can you tell us a bit more about your background and how you came to work in nutrition and oncology?
Oh, yeah, sure. Thank you. Thank you so much for having me on this podcast. My name is Malvi Shah, and I am a nutritionist. Been specializing in oncology for the last, I can say, 4 years now. And I'm quite passionate about helping all people like right now, especially talking about cancer. Yeah, so right now we're talking about something that's affecting a lot of families right now, in mostly worldwide and globally. So yeah, cancer and nutrition, a big thing.
Okay, so can you tell us about the importance of nutrition in oncology?
Yeah. Okay, so nutrition, as you know, in anyone, whether you're sick or not, oncology right now, especially in Kenya, it's like the third leading cause of death. So we have a multidisciplinary approach when it comes to cancer, and nutrition is part of it. So why is it important? Is it we're trying to make it easier and making it smoother for our patients as they go through treatment on helping maintaining their side effects and trying to manage those effects and just make basically smooth treatment, because nutrition is everything regarding immunity, regarding strength, trying to avoid malnutrition and something called cachexia in cancer, which is very common as well. So basically I'm just trying to make their treatment as smooth as I can nutritionally. Yeah.
Could you tell us sort of the differences? Let's say the differences in nutrition from when a patient is undergoing treatment and then from when they've finished the treatment. Is there a difference or is it more or less the same thing?
Okay, that's a very good question. Because number one, you need to know everyone's different. Everyone's body individual needs are very different. So yes, during treatment, the body undergoes a lot of stress. Okay, so um, a patient, depending on your diagnosis, depending on a lot of factors, they can go through maybe one type of treatment, which maybe can be only chemotherapy, or two types of treatment simultaneously. So, of course, automatically the body is so much under stress. So, we have to sometimes put them on a strict regimen depending on, as I said, diagnosis or how bad the side effects are. So, during is a bit of we have to be back to back with them, but after they have a kind of a bit of a smoother regimen. But at the same time, even if you talk about treatment, let's say they're going under chemotherapy, it does take some time before it leaves your body. So as much as we can say maybe the cycles are over, the treatment is over, the body is still, it takes time to flush out basically that chemotherapy or the waves that is being affected to that certain tumor. So it does take a while. So that's why we still put them on a longer time of treatment before I can say that now I'm introducing something maybe junk for them, Yeah.
Okay, right. So like during the chemotherapy process, could you be a bit more specific as to like what exactly that nutrition is? Are you tracking,
Yeah.
macronutrients and things like that?
Yeah, that's a very good question. So as I said, we also look at different types of diagnosis. Okay, so if you look at something like breast and you look at like colon, these are two different things. Okay, this is now affecting colon is affecting the digestion system. The breast has nothing much to do, but if you look at it overall, treatment, chemotherapy, there are different kinds of drugs. We say chemotherapy in general, okay, but every drug has its different side effect. So as much as the body will be trying to adjust to those side effects, yeah, so we do calculate, we look a lot at their weight, their height, we look at their lab results, which shows us a lot about how they're eating. There are things like immunity we look at. Their macro and micro are gotten from their dietary history. Yeah, so we do something called a 24-hour recall. And sometimes we have some food questionnaires depending on, since I deal with a lot of local clients, meaning people who come from the villages, the outside parts of towns and cities. So there's a lot of traditional stuff that we normally look at. So I can't just come and tell someone do broccoli when I know they come from a part where they can't even get broccoli. So social assessment is very important for us as well. That's when we're able to calculate those macro and micronutrients.
So then, let me ask you, what is the difficulty do you face with, say, patients coming in from villages? It could be, their reluctancy to have treatment, or their reluctancy to change the diet. Those
Yes.
types of things. How is it difficult in the start, and then how do you overcome that?
Wow. That's actually you've literally hit, they say what, the hammer on the nail like that. Our biggest challenge, number one, is you will see a lot of patients coming in when it's already a very late stage of cancer. Okay? So getting a late diagnosis. That is because maybe they've gone for screening that is too late. We see the changes in diets and lifestyles. That's a very big issue. Also see a lot of, right now economy is so hard here in Kenya, so people can't even afford sometimes the basic things like fruits. So our biggest challenge is that economical thing. We're talking about how when they come it's quite late, so all we can do is palliative and not even curative treatment. Screening, awareness on screening is needed a lot, so that's a big challenge. As oncology, we do try to have outreach programs making people aware, and there's also a big stigma. People are making it like cancer equals death. So that stigma of people not able to come faster to the hospital and get treated, that's another thing. And there's something called, here in Kenya we call it dawa ya kienyeji, meaning traditional drugs. So what they do is, the villagers, and they have this thing in the village where you have cancer, okay, I have a concoction for you, you take this, you'll be good. So people rely on that, and by the time they're coming, actually it's already like they're in a severe condition. So those are many of our challenges. It's quite hard. As much as a nutritionist, I can say do this at home, but sometimes even the economic aspect comes into play. So it's a big it's a big challenge.
Okay, right. I see. That's interesting.
Yeah.
And then, are there do you find like certain in trends? So like certain types of cancers react differently to certain types of foods, and then because you mentioned, for example, breast and colon,
Yeah.
do you find there are differences
Yes.
across the board?
Yeah, there are there. Um, Again, as I said, everyone's different. Yes, we have those who also go uh, for surgery and then come for treatment, depending on their treatment protocol. So sometimes, for example, as you have said about the colon, is something that's a very big challenge. So things like absorption of foods, people become very malnourished because sometimes certain foods that are very maybe high in carbs is what they're having, and they're supposed to have something low so that the fiber is a bit it's absorbed easily. So there are those challenges, yes, that do frequent a lot in treatment depending on your type of diagnosis, especially. Yeah, that's my our biggest challenge. That's why we say we go individual basis on that one.
Okay, right. Could you expand a bit more about the assessment? So how you're assessing the patient's individual needs
Yeah.
and for their dietary requirements?
True, true. So there is something called a MOST. It's a universal tool that right now we use just for malnutrition, because as I said, malnutrition and cancer go hand in hand. For patients to become very wasted, which means the muscles are wasted because of the treatment that they're going in, because they need a lot more of the proteins more than the carbs. So we do have this MOST. It's a universal screening tool for malnutrition, and that's what we normally base it on. So that's what I said, the labs come into play in that tool. The BMIs, we use the BMI, the body mass index, using the weight and height. And then for us it's very important to keep screening them, because in like a week sometimes patients even can lose 5 kilos just because of treatment.
That's a lot.
Yeah. Yeah, so we have to, we're back to back. Every visit of theirs is very important to us.
Do you recommend any supplements to them? Because
Yes, yeah.
it's hard, to do it just with natural foods.
Yes, you're very right about that, because as I said, there are those people who can't even get, you can imagine how expensive proteins are. First of all, like the meats, we're talking about the meats and the fish, and people are coming from the village. It's so expensive for them to get that. That's number one. So number two, unfortunately, our supplements are also very expensive. Actually, I think everywhere in the world supplements are expensive. So I'm telling someone who's already, the cancer treatment is very expensive, to buy a supplement. So we have a variety in our clinic. Yes, we do give them we call them the high energy, high protein supplements. Depending, also, it's given depending on how bad the condition of the patient is. But yes, we do have to include them. And when the supplements come into play, I've seen that in especially two diagnoses. We have the esophageal cancer, when they're not able to even pass food through the mouth. That's when patients get very malnourished. And colon cancer, because of absorption of nutrients. So there's a lot in those two that we really do put supplements on.
Okay. And so, like you mentioned, for example, the patients can lose up to 5 kgs
Yes.
during treatment. So now, also to in a way get that back, that also has to be gradual, right? So how are you ensuring that it's not done too quickly? Because I guess that's also dangerous.
Yes, it is. You're right about that. That's called dumping syndrome, actually. So what happens is, you need to know one thing. When it comes to chemotherapy or radiotherapy, treatment is given according to something called ECOG, how well the patient is doing, how physically well they're doing. That's number one. We look at their weights, something called basal, it's called BSA. So we look at that to give chemotherapy, let's say chemotherapy dosages. So if a patient is, let's say, talk about a patient that's normal BMI, okay? They've lost 5 kilos. That patient is already, now let's say, underweight, okay? The dosage of chemotherapy also goes down, and it will go down to a certain limit depending on the age and the height of this patient, and then we stop giving treatment until they get back the weight up. And it's true, gaining weight is not easy. So we do keep them, like, we put them on close follow-up for at least 2 weeks, so then they gain the weight back, and then restart or they can start the treatment all over again. Yeah, so there are so many factors that come into play.
Okay, nice, nice. Are you able to give like an example or like a success story of someone that you have treated, and how you
Yeah.
have taken them through that process?
Yeah, actually, there's so many I've had. So what happens is, I got this newly diagnosed patient, like a patient who just comes in, okay? Just had esophagus. She has esophagus cancer, but then, like, they just got it detected, and I think she was around 28 years old. Um, she came in with a weight of 38. Yeah, 38 kilos. Height was, I think, what from my assessment of hers was, she was already severely malnourished. Okay. And then number one, she doesn't even, because it's esophagus. Esophagus is the food pipe, right? So that's where food doesn't even pass through. So she was only relying on milk, and we call it uji porridge. Okay. Those were the only things that are going through. And from what we saw, we detected she needed chemotherapy as soon as possible. But because of her status of how she was malnourished, we couldn't, until she reached like 40 kilos and above is when we wanted her. So we gave her supplements, had to boost her with supplements. We use things like Ensure over here, Fontacti. These are different kinds of supplements we have. And for her, depending on, also, now that she can't eat, the first thing we do normally do for is putting a feeding tube. So they go through a small procedure of feeding tube. They put it goes directly to the stomach. Then she's fed from there. But before even the feeding tube is put, she had to gain the energy to go for that procedure. So that's why she was put on a supplement. Then she went for the procedure. She started feeding. She gained weight in like 2 weeks, and she came back and we started treatment on her. So she is pretty doing well. But you see, I told you with these patients, even the side effects does bring them down. So maybe they've gained the weight, but then because of treatment as they start, the side effects come into play. And, sometimes some people don't even have the money. Like I have the side effect, let's say, of vomiting. Okay. But then they don't automatically go to the doctor. They'll wait for like 5 days. So you can imagine how much is already lost. So basically a cancer patient's journey is, it's up and down. Like you have to, it's a step by step process. That's what I can say. It's not just easy. Like I know this will work for sure. It will, but there's a lot that comes into play. Even talking about their social background, like who you're staying with. When you're sick, of course, the people who stay around you also make a difference on how well you feel as fast as possible, right? The same thing that happens with our cancer patients. We have a lot of cases of like women getting cancer and then maybe their husbands leave them and they're disowned from their houses. So that, we said the mind is the biggest tool, right, in becoming better and stronger. So that is a very big factor for us as well.
Oh yeah, okay, that's interesting. I also wanted to ask about that. It's like, how much is your work involve, talking to the family members of the patients as well? So, like as you said, like husbands, parents,
Yes.
um, you know, children if they are like quite old.
Yeah, that's a good question because every time there's a new patient that come in, we see who have they come in with. We ask them who they stay with at home, because we really encourage them to come with at least one. We call them caregivers, so at least one caregiver, whether it's a kid, whether it's a friend, whether it's a sister, someone who they know they can at least rely on. But then you tend to realize some patients come in, their caregivers keep changing even when they go home. There's a sudden change of caregivers, and everyone will not take care of you the same way another person has. Like everyone has a different way of taking care of someone. So that is also something that we go through. We call it, so I do a lot of counseling as well. You have to do, it's called nutrition counseling, because nutrition is affected not only just food. It starts with the mind, starts with the people around, availability, affordability. There's so much. Yeah.
Oh, okay, that's interesting. Actually, could you expand a bit on the counseling part? Because I didn't know that was also
The
like
costing.
the counseling part.
Oh, the counseling. Yeah.
Yeah.
As I said, like anxiety is one of our biggest topics when it comes to cancer. And I know I'm not a psychologist to talk about this, but we as nutrition, I told you we have a team we work with. So we have to take them step by step, such that first of all they need to accept the fact that they're in this condition. They're going to do this the next step. So we have to make sure of that. There are some patients who come, the caregivers tell us not to tell the patients that they have what they have, and it creates a lot of anxiety for our patients. So some people lose appetite. When anxiety comes in, it plays with your mind. So appetite is lost. Sometimes patients, because of their conditions, as much as they've accepted it, it takes time. If someone had just told you you have cancer, of course you're gonna take some time to process it, right? So a point is, how do we deal with the loss of appetite? It comes with counseling too. We counsel them. We want to find out every detail of, I left you 2 weeks ago. You started your first treatment, you're in your second. What happened in these 2 weeks? I want to know, how was your feeding pattern? Who are you staying with? How did it go? Did you have change of any side effects? These are very small, minor details that actually help us to help our patients. So it's them helping us to help them. Yeah.
It's amazing how much, like, what else goes into this whole treatment process. I think people take for granted or don't know, you know uh, actually how much there is, which is amazing what you've already told us. I wanted to ask you um something on, like, how do you know if the signs, or how do you get checkups, how do you know where to get checkups, what to check up on, like the way you can, when you get older you just do random checkups of your body, say for blood pressure, health, all
True.
that stuff, but then how does that apply to cancer, because it is a growing concern?
Wow. I love that question. A lot of people, we have, let's say, stomach ache. Okay. we just sit at home and we just like, I take this, I'll just take this pill, be fine. So we do a lot, we do encourage everyone to go for screening. Okay, these days screening, when I talk about screening, it means, as you said, the regular checkups is important. That's number one. Any signs and symptoms, like for example, there's something that I've really noted down from this time that I've been working around with cancer people, is these stomach pains and ulcers that we keep talking about, these small signs when something is, when you've tried to treat something, let's say ulcers, okay, and you've probably spent 1 year just trying to treat it as ulcers. Try having second opinions on how your body is feeling, get other opinions and try and evaluate, go to different hospitals, go to different doctors to actually evaluate. Because what I'm saying is, our gut, like the, we're talking about, let's say GJ, it's called GJ, gastroesophageal junction. So we have a lot of tumors coming there, and the amount of people that say they've treated it like ulcers is, it's crazy. So I think, don't ignore any signs and symptoms. If it keeps it's been like maybe a month that you've tried the medication, it's not working, try other opinions. When we talk about breast cancer, there's something called breast self-screening. You can do that in a mirror. These days, everything is online on how you can do self breast screening. If it's cervix, we always have, as soon as you're sexually active, you should get it done. Get a pap, something called a pap smear done. If you're having prostate, of course, that's after 40 and above. But other things, like if you can't swallow your food for, like, let's say a month, that's a sign of something. People should go and get checked. It starts from getting checked, and then from there the process goes.
Then is that where you're talking about those camps, those outreach camps? That's where
Exactly. Yeah.
that comes in
Yeah.
from there.
We're trying to
Yeah.
do that in every community and village, so they're more aware of how they're feeling. Yeah.
And do you find that like people's attitudes have been changing over the number of years that you've been working in this?
Let me not lie to you. It's quite a stigma still. Okay, it's like when HIV and AIDS was still a stigma. Right now, I think cancer is such a big stigma because we have done outreach camps in different areas. Some areas they're very open minded. People are coming for the screenings. Other areas you still, they're shy. Like people are very shy. People are very reserved still. They're like, no, I'm okay. Someone's been bleeding for more than two months, and they're just quiet. They feel like, oh, it's gonna go away. It's gonna be fine. But then they find out they have cervical cancer. So like, that's what I'm saying. If you see our data, in our data, it shows the stage 4 cancers are way more than the ones that come as stage 1. It's like a 1% of stage 1, which is quite sad.
To be fair, even I
Yeah.
don't usually hear of stage 1 cancer cases, like barely.
Exactly. It's a
Yeah.
difficult one.
Yeah, I guess it's as you said, like people don't really take it that seriously until it becomes really bad. They sort of think
Yeah,
they can postpone it.
I
Um,
think it's fair to say, I mean, we're somehow all like that, but sometimes when some conditions are just so serious that it's just not like curing, you're just not feeling better, I think you should take it seriously.
yeah. Would you also say it's also maybe due to maybe the state of the economic situation that they're in terms of, if they suddenly go to the doctor and have to go treatment, then, they may miss days of work, they may not get
Yeah.
paid, things like that.
But it is, and as I said, like right now, economy is so hard. Like even for people to just come to the hospital, they're thinking 110 times. Like they think of transport. They're not thinking about, it's just easy for me. Let me just go to the doctor. Like people like us stay in cities, others who stay in villages, they have to think of transport, going to the city. Should it be a day event? If I'm staying, how much is going to cost me? Coming back is another cost. Then the medications, again, the treatment process. It's just not easy as we think it is for a lot of people out here, and our government also doesn't is not making it easier.
Yeah, yeah, absolutely. And you mentioned early on about you having to deal with a lot of like misinformation, especially maybe like villages. They have like they try to promote some sort of concoction or something like that, And I mean, in every form of life, there's so much misinformation, especially around nutrition and food. They
Oh
always
yes,
promote, some sort of medicine or some sort of food that's supposed to cure everything. Is that a
yes.
big challenge for you as well?
Wow. I think you have literally, that is actually what I always have challenge with.
He's
Like
hammered all the nails.
I'm telling you, like exactly, they call misconceptions, right? Like there's so much when it comes to nutrition. I won't lie to you. That we call them the myths, right? A lot of myths. Even let's say, for example, we talk about let's say these superfoods. You know, like okay, yes, we see the strawberries, the grapes, we see the broccoli, the mushrooms. Those are what the internet says as superfoods, right? And no doubt they are superfoods. But what about the normal fruits and the normal veggies? What are they doing? They don't have enough nutrients. So people are misconceptioning that superfoods are cures, to cancer. And a lot of my patients will come and say, oh, I've heard I should be doing a lot of strawberries and grapes, but I don't have the money. I know it's going to cure my cells. And it's so sad because in the internet as well, people get confused, very confused about these different types of foods, different types of nutrients. Everything we say, too much of something is poisonous. Is like, look at the concept of fruits. Okay, even too much of it has its side effects, right? So it's also about, it's just educating them, basically telling them there's nothing like, I wish if there was a cure, wouldn't we be distributing it throughout the whole world?
It's interesting. Um, so one thing I wanted to ask you is, from your experience and from the patients you've seen coming into work, what do you think is triggering these higher rises, or what have you seen is causing a lot of the cancer cases nowadays?
Yeah. Okay, so as I have already said, I think even our times have really changed, even like how food is being produced, processed, there's, so if you're something like you're asking, like what causes cancer, right? The risk factors, basically. And there are so many. We can go just highlighting them. Just genetic factors is one. Sometimes people inherit those genes, they call the BRCA1, the BRCA2, mostly related to, like, mostly breast cancer. And lifestyle choices, I think. Right now, talking about tobacco usage, talking about alcohol consumption, these are just risk factors, yeah? They're nothing like 100% directed, but they're also categorized as carcinogens, things that are causing these cancers. And then maybe this diet that we keep talking about, diets that are high in red meats, processed foods, sugars, and a lot of salt. It does increase the risk. That's what I'm saying. Um,
A lot of salt
People
as well.
forget.
Interesting.
Yeah, and salt too. People are misusing also salt. Even, what happens is, it triggers other comorbidities. Those comorbidities are the ones that actually have a higher risk of getting cancer. The comorbidities I'm talking about are things like diabetes, hypertension. Yeah, those are also risk factors. Then physical inactivity, obesity, those are other factors. Infections, have you heard of the HPV infections are causing cervical, hepatitis B and C, environment exposures, like, the pollutants, the environment, air pollution, the industrial chemicals, the aflatoxins that are found in the maize and the groundnuts, the age and hormones as well. So you see, I can't pinpoint to one thing, Rishi. I would just say there's a lot. Then I can't, like, I do agree. If I see maybe, let's say, liver cancer, you would be like, you'll be looking at their history, right? You're looking at their family history, looking at their lifestyle choices. And yeah, you see, if you look at cervical, you want to know if they've had infections before. So each cancer comes in with their own kinds of factors as well. Yeah.
And could you also tell us about how you got into this space? Is what inspired you to work in this space, and also like what you did academically as well to be so like knowledgeable about this?
Yeah. Sure. I went to Bariton, University of Eastern Africa, Bariton. It's just here, like 45 minutes from Eldoret, and I got a degree in nutrition and dietetics. I went for my license in a community based village, and I stayed there for a year. After that is when I started doing like experience now. So I just found myself in a voluntary space in a place called Faraja Cancer Support. And from there, I just ended up loving what I'm doing. Like, it was a public hospital. I was working with a lot of, it's still regarding oncology. So I started realizing that I was getting so comfortable and I was so passionate about it. And I continued wanting to practice it.
What inspired you to go into nutrition in the first place? Because it's quite unique, I think.
It is unique, true. You're just gonna laugh, because I didn't plan to. I won't lie to you. I just didn't plan to, but I felt like I could be of help, like to someone. But I wanted to do something totally different. I thought about nursing and all, but I was like, I wanted to try a different direction, something that is evolving so much. And I actually, funny enough, had applied for a major in chemistry when I was heading into this university. But then I decided that I looked at it and I said, no, I think I'm going to reapply for something else. So I ended up loving it. Yeah, nothing inspired me, just that I just wanted to do something that would help someone, you know? Yeah, but in a very different way.
Nice, nice. So, but now, obviously, you have a lot of knowledge about oncology, but I'm guessing if your degree was quite general. So, is that all that knowledge that you gained was on the job, basically?
Yeah, you're right. On the job. And then I have been specializing in oncology. We have a course as well that I am on progress of doing so. But of course, working practically is like so rich. So I do a lot of we can say ongoing kind of courses that keeps you updated on what's happening. Yeah. So that's what I just keep doing. Just keep updating myself to get better.
How do you keep yourself motivated at work actually? Because it is a very sensitive line of work, I feel, and a difficult one.
I love that question. I love that because it is true. It's a very tense environment. But I'll tell you something. I think in every workplace, your work environment should make you happy. Otherwise, trust me, no matter how high your pay is, even if your work environment is poor, trust me, you're not gonna even be wanting to wake up every day. We have a fantastic team on board, and I think we're always every month we are having something called debriefing. We sit down, talk about what's disturbing each and every person, and communication. Our CEO is very, very, that's his goal: communication, communication, communication. Keep talking. If you're feeling this way, come express it. We talk about it. I think it's just workmates and work environment that makes it easier. And also the passion of loving to do your job that makes me want to wake up every day and be like, I want to do this. You know, yes, they're hard. I'm not saying that every day is a fantastic day for me. No, there are days I do find it difficult. But then I think talking to someone does help me a lot. Yeah.
And I think that sort of positive attitude is also really important for someone in your position or someone who's like in a medical field, like giving advice, because I mean, you don't want to go to a doctor or to a nutritionist who's in a bad mood, who doesn't enjoy what they
Exactly.
do, right? Like
You go,
you're
you
already
go with
sad,
the
and then
addiction
you
to
go
them.
and then,
Help me out. No, you're dead. You're dead. Go.
yeah, yeah,
Yeah,
yeah.
it's so true, and unfortunately, Rajat, I'm not lying, you feel so sad right now. Our age kind of I'm getting clients who are like my age, like in the 20s. My last client last week was 24 years old,
Wow,
and
that is young.
very, very young, and whatever she's going through is a lot. And you look at yes, you may not have a good day, but you look at someone who's even having a worse day than you. Why can't you just make it a little bit better for them? Sometimes we say leave all your stress behind, leave it at home. And we also say, as you leave the gates of our hospital, you leave everything that happened in the hospital behind, But sometimes you do carry the thoughts, you do carry those worries. But I think everyone has a different way of getting therapy. Sometimes it's music, sometimes it's reading, sometimes it's gymming. For me, I love it, I love gymming. So that helps a lot to me too. Yeah.
Have you been doing
Just
sessions with Rishi?
FYI. Yeah, yeah, so just FYI, Malvi is also a very good boxer. I will give that as a point to note. So
I try,
don't piss
Rishi.
her off.
I try.
And yeah, actually, so like based on that as well, I want to ask because, so like let's say someone in their 20s, and especially in this day and age with social media and stuff, it's a very like sensitive time. I think like me and Rishi, because there's a lot of like pressure, right? You always want to, you're in like a race, right, to do things. So it's being quite demoralizing for someone in their 20s to have to face that.
Yeah.
So like, what's the differences in I know just the way people react in terms of, let's say, their 20s, or and then let's say someone who's like really old as well, let's say in their 60s, 70s, as in how are you
Oh,
managing those dynamics?
wow. That's a very interesting question. Unfortunately, I am the one who, my workmate is, we work according to what you're comfortable in. So mostly all my clients are very young. Like my workmate can't deal with young ones because he's also sensitive. So I work with young ones, and I do. It's let me not lie to you. Someone has been told you have this, and you're going through treatment, and they stop schooling, they stop having friends, and then they start detaching themselves. Even, let's say, maybe this boy had a girlfriend, he just says I'm not good enough, so he'll detach. So there's, if you see the young ones, yes, they try and be strong for themselves, but you can see how badly it affects them. And it is hard on them, though. I'm not lying. It's, you see there's a lot of the social connections that they lose, which is quite important for them. And if you look at the old ones, the old ones, it's, we're all humans. I think I can say, whether you're old, whether you're young, whether, if you're sick, you're sick, you always need that support. And it's hard, I think, for both ages. And especially, as I said, environment. For patients, you should just look at their environment, their caregivers, because some can be very demoralizing. Some will be fantastically be there side by side, not giving up on you. So, and then patients start feeling like, we don't want to give a burden to my caregiver, so they stop talking. Like, I had a young fellow. He's like, he didn't want to disturb his mom to just keep making the things he wants, so he just stopped eating, so that the mom doesn't get stressed up. So I was like, you're making things harder for mom. So I think it's hard on both ages. Yeah, that's what I can say.
Yeah, yeah, yeah. I also want to ask, because I want to go back a bit to the sort of the like the misinformation stuff like that. Like, what are some of the, or like one big misinformation, or one big like myth that people that you see in very commonly?
Sugar feeds cancer. That is the biggest myth I will find every time. Okay, so what happens is patients just come to me. They'll be like, Daktari, we've stopped having, I have stopped having sugar. So you're like, why? They're like, oh, people are saying sugar is the one that increases my cancer cells. Okay, so it's partially true, but it is put the wrong way. So I always say that, of course, all our cells in our body use something called glucose. Okay, all of them need sugar. So they think that cutting out sugar causes cancer cells to starve. I don't know if you get me. Yeah, so they stop the table sugar, but they're not understanding the fact that, how do the other normal cells work? Even the cancer cells, they continue to grow, right? So it's from the things we eat as well, the carbs that we eat, the fruits that we eat. But it's just that, uh, reducing the sugar does not specifically target the cancer cells. It's actually related, the sugar is related to obesity. Then the obesity is related to almost 13 types of cancers. So it is interlinked. I wouldn't say it's indirectly linked, not directly linked. Yeah.
There are also two more myths I want you to actually confirm,
Yeah.
that I always hear of. One is when you eat burnt foods or like burnt
Yeah.
toast, right? The
Yeah.
increased risk of cancer from that. And second one is drinking very hot liquids. So, like, I think a lot of Kenyans drink very hot tea.
Yeah.
That also
Yeah.
increases the risk of cancer. Those two, what are your takes on that?
So, yes, it's called charring of food. Yeah, when we burn them, it's called charred food. Normally, what happens is when you digest that burnt part, even the barbecue that we have, it's the same thing as having the burnt toast. Just that, um, what happens is that chard, when it is ingested in your digestion system, it actually releases something called heterocycline amines, which is very harmful to your gut. So it's not that it causes cancer. It's just that we there's a way we say these meats that you barbecue them. Try not barbecuing them first of all. You should do it, if you're doing it, it should be like once a month. Like moderate and enjoy it. Don't do it every now and then. If it's the toasts, try not burning them. So it's just the digestion system that's actually harmed in that process. Okay. And then you talked about you said hot liquids, right? Yeah, so western areas as well, a lot of people do the hot liquids, and research studies actually, it's not 100% proven, I wouldn't say that, but there is some studies that are done that it's causing esophageal cancer. It's a risk factor because of how it's causing the lining of the esophagus to keep being inflamed. So I am not 100% sure that it's 100% true. No, I don't think so as well.
Okay. Another myth that I want to ask about is this whole thing about like zero calorie. So, for example, we say
Fasting,
Diet
you mean?
Cokes. No, so
Oh,
like
okay.
for example, Diet Coke. A lot of people
Yeah.
say actually full fat Coke in a way is would technically be more healthier than Diet Coke because even though it has more sugar, because Diet Coke, the stuff that they put in it may be like bad for your gut, and like there's similar things as zero calorie sweeteners and things like that. What are your thoughts on that?
Especially the sweetness part, because
The
they're like,
sweet,
this sweetness
yeah.
is better than this one.
How do you generate in a zero diet coke that sweetness? That's my question actually. Um, I don't anything that is processed. First of all, it's already processed, right? It's already refined. It's still a zero diet. So okay, I will look at it in this way. How is it helping you? Does it have any nutrients? Yeah, I do believe yes, you can do this diet, the zero, it's called zero coke, right? It
Yeah,
is a
Coke
better,
Zero
they
diet.
say
Yeah,
it's a better option, yes, but I do think it contains sweeteners. So I would just say this is something like moderation, and I'm just looking at what nutrients it's what am I losing if I don't do it, if I don't do it. Yeah, I don't know if you get my concept. I look at something and be like, how is this helping me and my body in me?
yeah.
That's just
I guess I guess,
concept.
I guess as you said, the main thing is moderation, right? Just have it in like balance.
Yeah.
Don't overdo, do anything. Um, yeah, and also like, are there any certain advancements in like research or things that you think are coming up that may help with your job?
There is a lot, even like unfortunately, like there's a lot of research still being done. Nothing that has been concluded. I wouldn't say that. All the guidelines that I have been reviewing, and we keep viewing them to keep updated our knowledge, is just be active, have a balanced diet, look at what you're eating and moderate it, like there's nothing major there, unless as I said, unless you're diagnosed, then we have to cut out on some things depending on your individual needs. That's when I come in. But
But what about treatment? So like any progress in technologies of treatments? I know how it's treating people. Is the improvements there?
yeah, I think there's a lot happening, especially in Germany. There's so many like experiments that have come out and they've gone successful. Things to do with colon cancer. um there's some, I think there's some new machines that have even come out for targeted treatment, like you know how we have radiotherapy, but it's done in a one part in a region, but this is now direct. It's called a knife. I'm forgetting the full name, but it's something called a knife something. It's just targeted on the tumor specific. So there are machines that are coming out that is specifically targeted to different types of, if it's the exact location, it's going to the exact location. It's not going to spread anywhere around, or I don't know if you get me, you know. But there's a lot of a lot of research coming out. There's so much treatments that are coming out, but unfortunately, you know, cancer treatments are very, very expensive. So you can't even tell someone go to Germany, go to here and go to there, you know. Yeah.
Yeah.
So
Actually, there's something I actually forgot to ask at the beginning, but we talked a lot about like cancer treatment and chemotherapy. Could you just explain what exactly happens to the body when someone undergoes chemotherapy?
yeah, that's a good question. So chemotherapy is given either orally or via IV, that is via the veins, depending on whatever you're going through. So what happens, depending on your condition, as I said, there's something like prostate. If you're taking orally, there's something called hormone breakdown, such that it also, I'm not trying to be a doctor here. I'm not trying to scare anyone here, but it does lower the testosterone to help work on the tumor itself. So we do get a lot of libido issues when it comes to that type of cancer. Uh, if you're talking about other chemotherapies as well, the body goes through a lot of inflammation. So you'll see immunity becomes very vulnerable for these people. That's why in different countries, people do it in a very different way, such that in our setting, chemotherapy is given in one specific area, and we try and tell them to minimize their social environments, not to go out in crowded areas, not to sit with people in crowded rooms. So immunity is the biggest factor when it comes to treatment, especially chemotherapy, even radiotherapy. We see that a lot. So we do have to put them on immune diets and, you know, immunity boosting diets and things like that. So inflammation is one big thing that keeps happening. Yeah.
Okay, and so like when you say like the immunity goes down, is it basically because the cells like within their body
They're
are
attacking,
breaking down?
yes.
Attack.
Yeah, the
Okay.
cells are being attacked. So the cells are working to attack these cancer cells, but at the same time, those that are being born, the new white blood cells that are being born, they're quite, like, we call them immature cells. In the process of treatment, they also get attacked. So there are no new emerging cells that are coming up to fight. So immunity does pull down. I don't know if you get my concept. Yeah.
Yeah, yeah, I do.
And we
And
see
in
that
some
a lot in certain professions, especially teachers, because they're always around. Teachers are constantly working, and if you're especially a person who's always around people, your immunity already, if you're already going through a lot of treatment, your immunity does become very vulnerable.
And something I've always been curious about is like how come someone who undergoes chemotherapy loses their hair? Like, what's the biological like reason behind
Yeah,
that?
alopecia, right? It's called alopecia. So what happens
Yeah.
here is it's because of the treatment. Basically, it's a side effect of the treatment that the drug just comes with. Okay, but there are certain drugs that don't have that. But sometimes a combination of drugs does cause you that. It can't be only a loss of hair. You'll see even their nails become very painful and brittle. Sometimes, I'm not saying this happens to everyone. I said everyone's body is different. So I can do the same drug and you do it different, but it affects us differently. Sometimes it's the skin color. People become darker skin color, and then the nerves maybe feel a bit painful, you feel your feet are painful, you feel like your knees are weak, your body feels fatigue. So alopecia is part of it as well, the hair loss. But always remember, after treatment is over, they grow back. Yeah,
Okay,
they
right.
grow back.
And also on the topic of these medicines, like I think we had a similar discussion with Dira and Amit as well, a few episodes
Yeah.
back. Is that you get a lot of pressure from like pharmaceutical companies or like reps to, I know, do certain procedures or do certain like diagnosis.
I think, aspect is, since we're an outpatient facility, we get a lot of pharmaceutical companies trying to sell their products. Like, we are in a constant, like, for me, nutritionally, I get like, right now I'm sampling 5 different supplements from 5 different companies, and it gets very tough on me because at the end of the day, have to make the best decision for my patients, which product is best, and which I have to keep in mind: affordability, quality, how well it's doing. So yeah, there is that pressure. It's like I have to keep giving feedbacks and be on constant feedback on them for them. So yeah, it is, I think it's part of just being a medic.
Yeah. Do you get also a lot of like like food companies come and say, we have this product, it's really good for health, or can cure this and cure that. Do you also get that as well?
Yeah, we do. We have like, someone comes and they have like, oh, we have produced, maybe this is for immune boosting. It's like a powdered form, and so we try our best to get them as approved. Like, we look at a lot of labels before we actually do that, and then sampling takes place, as I said, and then that's when we approve it, though. But we do a lot more from pharmaceutical companies than other kind of food companies.
For you in your personal life, before you went through this whole journey of like studying nutrition and working in oncology, was there something that you did in your routine before, something that you built in before, that now once you've been through this, you've changed?
I like that question because it's true. I have, there like, I did myself, like, I think I lost track on how I took care of myself, especially when it came to diet. I used to just eat anything and everything, and I never used to bother, not knowing after like a few months I've gained like 8 kilos. And I was like, okay, yeah, this is not me. My clothes are not fitting me. I have to buy a new wardrobe. I'm like, no, I gotta work on myself. And I think Rishi is part of my journey because he knows, he used to push me. Like, he is fantastic. We've gone through the journey of fitness and also calories. Like, had to cut down on a lot of things, and I think it all starts from the mind as well. Once you like, nah, I gotta work on myself and be consistent. Since then, I think trying my best for myself.
The person that's actually sorting out my uh, diet together with my brothers is Malvi. This is regarding to the last podcast we had on our fitness journey, and I'm telling you, it makes a big difference. Trust me, my immune system has improved amazingly. But back on topic of cancer, I wanted to ask you regarding the World Cancer Day. What do you usually do? Be it yourself or with your team or your workplace? What's the vibe?
Yeah, so all the hospitals who work with oncology patients, it's not a must that you're a center, so we go for a walk. It's like a charity walk, so we just go supporting all the warriors, the fighters, the survivors. We just go for they call it the cancer walk. It's just to make awareness as well. Then we do a bit of screening on that day for the public around us. It's normally done here in town in Eldoret, so that's how we celebrate together.
That's pretty cool. And so last question from me about the regarding the cancer topic is to anyone out there that's undergoing probably a treatment or recovery from the chemo. What advice would you care to give them?
Okay. I will say this. Number one, they should not be scared of whatever side effects they're feeling. They should actually take action whenever if they're next to a hospital near them. Take action on any side effects they're feeling, because all side effects are manageable. Number two, it starts with them. So they're the ones, I will say, as cancer fighters, please, I'll say you're the one to define your diagnosis, not the diagnosis to define you. That's all I gotta say.
Right. Amazing. That was actually going to be my last question as well, Rishi. So,
R squared, R squared podcast for a reason. But
yeah. So if you'd like, you can go on to the rapid fire.
yeah. Actually, before we go into rapid fire, Malvi, from your point of view, is anything we've missed that you'd want to share with our guests regarding the cancer topic?
No, I'm loving the fact that you guys have actually, as I said, you just hit the hammer on the nail. Is it that? On the
Nails are
nail on the
finished.
yeah.
Nail on the
You
head.
finished
Yeah.
everything. I wanted to say. I actually had all that in my head, and you just said exactly what I wanted to. So you've asked the right questions. I've really enjoyed.
We love that you kept on telling us that our questions were good. So even me and Rishi were like motivated. We're like, okay.
Yeah.
You
Yeah.
guys
You
are
can
good
clearly
at
see she's a
this,
professional
man.
in her work. She's a professional in her work because she as she said she does have to keep people up and running.
Yeah.
It shows it.
Uh,
But yeah, actually, so on to the rapid fire. I'll ask four. Rajat, you can ask the three because we live in a joint family with Malvi, so I know most of the
Wait, what's
answers.
the rapid fire about?
It's a
No, it's just a
surprise. You
nice
can't tell you now.
chilled out. Okay, it's a
Oh
surprise.
man, what do I like eating? I don't know.
Isn't that every girl's problem?
Hey, I'm not choosy, okay?
But let me start. Let me start. Okay, the
Oh
first question
no.
is, what's one hobby you have outside of work? Something nice that you enjoy doing.
Badminton. Love playing badminton.
Ah, very
Oh,
nice, very
or
nice.
can I add one more? Camping.
Camping. That's a unique one,
Well, I don't do it every day, of course.
and that's camping, right? Not glamping.
No, no, camping.
Nice, nice. That's hardcore. That's pretty cool. All right. Question number two. What is one book you would recommend to our listeners and viewers out there?
A Thousand Splendid Suns by Khaled. It's Khaled Hosseini. It talks about the dynamics of women and their relationships in families, as friends, as sisters. It's a beautiful book. I became emotional, but it made me think a lot too.
I think that's a very good one for, like I said, ladies to read nowadays because generally things have changed so much with a modern society that it must be difficult so many times for so many people. So that's an interesting one. Do read that. Do check that out as suggested. Yeah. Last question from my side for Rajat carries on is what is your go-to karaoke song?
Wow, that's a hard question. Let me think about it. Wow. I'm sure it'd probably be like a high school kind of song, maybe Akon, something like. Um, is it beautiful?
It's a classic. Classic.
Okay,
Yeah.
there are many. I have so many, so I this like I couldn't think of anything fast.
But I
Oh,
think you can never go wrong
that's a
with
good one.
Akon.
That's a
Yeah.
good one. But let Rajat ask the remaining four.
All right, cool. So if you could meet any three people, dead or alive, who would you want to meet?
Oh wow, wow, that's a deep question. Who would I want to
Yeah, anyone. It
meet?
could be anyone. Yeah.
Dead or alive? Oh, wow. I want to meet Sri Devi.
Oh, wow.
That's a very
Interesting.
That's a
I
very
love
interesting one.
I really love Sri Devi. Like she's a classic.
Wow.
In her time, she was a classic. I loved her role. I just like to just sit down and have a conversation with her. That's it. My second person. Wow. Maybe someone from my family. Maybe who passed away. Was a big pillar in the house. One of my aunts. So I would love to meet her. And then you said someone who's alive. Maybe he should be iconic. Who's this?
Akon, no?
Yes. Nah, not Akon.
Drop shot. Tell to you,
You can do
cryptocurrency.
karaoke as well.
Yeah.
Wow, this is a deep question, man. I'm sure I'll regret answering what I'm gonna say. Let me think. I know I'm supposed to think fast, right?
Yeah, I mean, but it's fine now. It's
Oh, maybe this guy from. No. Mm-mm. Oh, there's this lady. She's on Instagram, and she's fantastic. She's phenomenal. I normally follow her on Instagram. I'm forgetting her actual name, but she's so updated on the body and how food works on the body, and she's quite old. She has a very good experience. So sitting down and talking to her and probably, I think, work for me depending because of my career as well. So yeah, should be someone I'd love to meet.
Oh, that's an
I'm sorry, I'm
interesting
forgetting
answer.
the
okay.
name.
Right. If we find the name, then we
But
can
till
share.
I
then,
will
Yes.
I will
Until
I'll
then,
hook
wait
we'll.
for
you
the
up with
mess.
that.
Great. The next question is, what's your favorite quote or quote that really resonates with you?
Code.
A quote. A quote.
A quote? What do you mean by a quote? Like a fur
Like,
Like
coat?
a phrase.
oh, yeah, like a phrase, like a phrase.
Or like a quote?
A quote.
I'm sorry, I
I
think
like that answer more.
That was a first.
Think of like a
um
motivational quote or just
Yeah, yeah.
something funny or like something like that.
huh. Okay. All right. Give
Something like
me.
you are what you eat. Something something on those lines.
Yeah, yeah. I get what you're saying. I would say mhm. I think my biggest quote always I tell everyone is um live for today because life is short. Yeah.
Very good. Very good. Like that. Um, Next one is, if you could have any one superpower, what would you want to have and why?
That's a hard question because I want to be all of them, like visible, fast. I don't-
You know what? Fair enough. Fair enough. I mean,
yeah, I
yeah,
mean, it's hard to choose one though.
I
One.
think we'll get her the Lord of the Rings ring, one to rule them all.
Yeah, that could work for me.
great. We can go with that. Okay, and then final one. What's your dream holiday destination? Or if you have already been there, like what country was it?
I want to go to Namibia actually.
Oh,
Namibia.
interesting.
That's an interesting.
I've been just seeing how people are exploring Namibia right now. It looks very interesting. I think the scenery it's different from normal. Nothing beach, it's like a bit of a desert, but it's classic in itself. So I think Namibia.
Oh, wow, that's very interesting. I've never heard of anyone say that. So I'll have to check it out online.
You can
Yeah.
tell when she said that she has a good hobby of camping. Those people usually have a unique taste in very interesting spots, like beautiful areas.
Yeah, I know, Munich. Thanks, Rishi.
Good.
What?
Amazing. And great. Yeah, we can. That's the end of the rapid fire.
Oh,
Um,
wow.
Amazing.
That
Actually,
was so
anything
much
else to
fun,
add?
guys.
Yeah, glad you enjoyed it. Glad you enjoyed it. I
Thank
think it was
you.
really fun for us as well. It was really interesting
It
to.
was
There's so
very
much we didn't
very
know.
informative. Also it's a very, I think it's a very important topic to discuss, especially nowadays. It is in everyone's face, so it's an important one to know. I think you've touched on almost pretty much everything out there. You know, we appreciate that.
No, thank you as well. It keeps me updated on my knowledge too. This is something very important. It's something very serious actually right now. So I'm so happy that you guys hosted me on this. I'm appreciative. Thank you.
Oh, great. No, it was great to have you on. And yeah, to everyone else listening, hope you guys enjoyed it. And yeah, we will see you in the next episode.